Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. So this procedure is slightly different. It's of a patient who attended with a mastoid cavity, and I'm going to explain what a mastoid cavity is, so stay tuned. Essentially, I'm just going to summarise what I'm doing in the procedure so that I can concentrate on the explanation of a mastoid cavity and why this patient has got a mastoid cavity. What essentially I'm going to be doing, what you're going to be watching whilst I'm talking, is me just using a fine end suction tip to just peel skin. There's no wax, it's just skin, and it'll all come together. If you continue watching and listen to my narration, hopefully it'll all make sense what we're doing and why we're doing it. So what is a mastoid cavity? So the mastoid process is a honeycomb structured piece of bone at the back of your ear. So if you want, you can at the moment whilst I'm talking, if you're on your right ear, for example, if you just get your finger, go behind your right ear, and you'll feel a flapped region right behind your ear flap, the pinna. So that's the entrance of your mastoid bone. So the ear canal itself, let's just take a step back. The ear canal itself is composed and housed within the bone called temporal bone, and then in the case of the right ear, just behind that you have a mastoid bone. So the mastoid bone, the mastoid process, it's got loads of air pockets, it's porous, it's got a honeycomb structure, which makes it susceptible to infection. So if you've got otitis media, so a middle ear infection, and your middle ear is full of infected fluid, this fluid can get absorbed by the mastoid process because it's porous. And we call that mastoiditis. Mastoiditis is when you have that, it's very painful behind your ear, and it's also very red and inflamed. And if antibiotics treatments don't work, that will need to be surgically removed, drilled out, because that can cause serious problems long term. It can lead to meningitis, facial nerve damage, worst case scenarios, brain abscess, and even death. So it can be very serious, but there are obviously extreme cases if they're not treated adequately and in time, in a timely manner. Also, if someone has a cholesteatoma, so if you just look at my videos, I've explained what a cholesteatoma is quite recently in a few videos. A cholesteatoma essentially though, if the eardrum is sucked in at the top, in the attic region, it creates a pocket, and dead skin that normally die and shed gets trapped in the pocket, and that dead skin then gets bigger and bigger. The eardrum can get sucked further in, and so it creates more of a pocket, and that dead skin formation can then get infected, and we call that a cholesteatoma, and that can start eroding and eating away, chewing up the middle ear structure, so the three bones. It can affect the facial nerve, which runs at the back of the in the middle ear, next to the organ of hearing and organ of balance. Again, a cholesteatoma can go upwards, grow upwards. It can cause a meningitis, brain abscess, like mastoiditis, can be very, very dangerous. And sometimes with a cholesteatoma as well, the eardrum itself. So again, I was going to get to come a step back. So if you look inside the ear canal, and just imagine you go. So we're looking in the right ear, and so you've seen loads of my videos now, so you're able to kind of imagine that you're looking into the ear canal. If you imagine the eardrums, you're going through the eardrum, so you've got superpowers, and you're able to teleport yourself through the eardrum. And then if you turn left and left again, so imagine giving someone directions. You go down that road, you turn left and first left. So same with the ear canal. The ear canal's a road, you go through the eardrum, and it's left and first left. That's the entrance to the mastoid cavity, the mastoid atrium. And sometimes when you've got your eardrum that's sucked in, the eardrum can get sucked into the mastoid atrium, and the cholesteatoma plug can grow inwards, and it can almost start filling up in just at the entrance of the mastoid atrium, the entrance of the mastoid. So, when is now a mastoid operated on? So, it's going to come back to the video very quickly. So, what you've been watching for the last 5 minutes, that's not the patient's normal ear canal. This is all on the left-hand side. That's the mastoid cavity. And onto the right, and I will make an effort to direct you when we're back into the normal ear canal. But all this is extra. You don't normally see this in someone's ear. All this you've been watching, it's all in the mastoid. So when do ENT surgeons drill out the mastoid? So if you've got mastoiditis and the mastoid bone is infected and it doesn't respond to antibiotics, surgeons have got no choice. They need to drill out this mastoid bone to prevent this infection spreading, as I said, to the meninges, which is the fluid soft layer underneath your brain. And that can cause meningitis, and also it can cause brain abscess and potentially death. So that's one reason. A second reason is during the removal of a cholesteatoma. So when you remove a cholesteatoma, it's so vital that all this dead skin has been removed. If not, and if there's some left over, this cholesteatoma can reignite its own fire and develop again and start eroding the middle ear structures and obviously structures underneath the brain as well. So depending upon the severity of the cholesteatoma, of course, and a CT scan is normally performed by ENT surgeons so they can see the extent of the skin growth of cholesteatoma in the middle ear. So what they do, they can open up the flap of the eardrum through the ear canal, lift the eardrum forward. So going to come back to that. So this is now the patient's ear canal. This is the normal ear. This is what you're normally seeing in a normal ear. This is where I would normally work when I'm removing wax on the right hand side. And there's in the middle you'll see this little ridge. That's where the ear canal, the back part of the ear canal would be. Where that ridge is just to the left. You can see it goes up and down. That's the old ear canal. That's where it would normally be. So you can see how much is drilled away. I've got a feeling my narration is going to roll over, so I'm just going to go back to the ear in a moment and I'll explain the mastoid. So in front of us now, that's the eardrum. You can just see the hammer bone in the middle. Obviously, there's a lot of surgery, so it's not your normal appearance. You can see all I'm doing is moving skin, and I'll come back to that, why we're doing that, why it's important in a moment. So yeah, ENT drill out the mastoid bone if they've got mastoiditis, and also they sometimes drill it out so they can visualise the mastoid atrium. So imagine you're removing a cholesteatoma, and this cholesteatoma it's so big and it's growing inwards in the middle ear, and it can enter the atrium of the mastoid. So they actually, from the external skull, they drill out the mastoid bone, go all the way deep into the ear, so they can have full visualization, so they know they're not leaving anything behind. At that stage, the ENT consult, and again, it depends on the individual, the case. If they've got kind of two options, they can just leave it like that, or they can then decide to just widen the ear canal completely and make it a part of the drilled out mastoid, so it's one big cavity as opposed to two little cavities. And each have got pros and cons. So when an ENT surgeon decides, after drilling out the mastoid bone, just to drill out the temporal bone, which is the boundary between the ear canal and the mastoid bone, and create one big cavity, they typically call that a radical mastoidectomy or open mastoidectomy. So the benefits of that is that the ENT surgeon can be really sure that there's no dead skin left behind, because you've opened up the canal completely and you can see everything. So there's a really minimal chance of a reoccurrence of a cholesteatoma or mastoiditis. However, when you've got a big open mastoid cavity, skin doesn't migrate as well. So that skin, as you can see, it's just layering, it's coating the canal wall. So an open mastoidectomy needs regular cleaning. This skin does need to be cleaned so as it's not shedding naturally, because that skin can get infected. And obviously, patients are going to be really careful of avoiding water in the ear. Because the whole bone has been drilled out, the organ of balance, the lateral semicircular canal, so the organ of balance has got three rings, and there's one that's coming outwards, we call it the horizontal or lateral. That's more exposed now because there's no bone protecting it, there's no ear canal protecting it, there's no mastoid bone protecting it. So patients can get quite dizzy when it's changes in temperature and pressure. So that's the pros and cons. If the patients have a closed mastoidectomy, so the surgeon decides not to drill out the intermediate bone, Cosmetically, it looks better, but this patient, and obviously it's less like that they can. Water's bad for the ear, guys. You know that. I always explain that. But it's less likely of the patient developing an ear infection if they get water in the ear compared to if they have an open mastoidectomy. Also, the skin tends to migrate naturally out of the ear because the ear canal shape's still there. It's still normal, but the ENT surgeon may need to perform another surgery a year later where they just go through the mastoid bone again, because that's hollowed open anyway, just to inspect, just to make sure there's no cholesteatoma that's been left behind and regrown. Well, I hope you enjoyed that video, guys. Take care. I'm going to try and condense that below 10 minutes so I can upload it into some other platforms. So you may hear me speaking a bit quicker near the end. Thank you. Bye.